For too long, older Americans in particular have faced the possibility of sicknesses that might not only wipe out their own savings, but those of their families.
And if you're ready to guarantee every American the same health care that you have, health care that can never be taken away, now, not next year or the year after, now is the time to stand with the people who sent us here.
We share a common goal, making health care more affordable and accessible for all Americans.
How do we make sure that families have some confidence that they can get health care when they need it and that they won't go bankrupt because their child gets sick?
And now it is up to us to get great health care for the American people.
And make certain that health care is a human right, not just a privilege.
Boy, for as long as we can remember, politicians have been promising to fix health care.
Well, they've certainly had different ideas on how, varied ambition, but the goal of improving the lives of Americans has always been there.
There have occasionally been successes, some big, some small. But it is undeniably frustrating to be hearing the same thing for so long.
Well, Denver 7 is committed to in-depth reporting on health care as part of our Contact 7 Cost of Care series. And tonight, we're focusing on the local level.
Because, as our Megan Lopez explains, Colorado lawmakers aren't waiting around for the feds to figure this out.
We'll make sure our state continues to lead. Check.
It's a checklist that makes the complexities of the Colorado healthcare system seem simple.
Check.
One by one, Governor Jared Polis marked off last year's to-do list as this year's done list.
We have been able to start making progress in just 1 year.
But between the camera flashes and claps and underlying reality,
No, we're not there. We're making progress. There's a lot more work to do.
Because the topic of healthcare is anything but simple, like the fact that last year's reinsurance law did save some people money, like the insurance company's costliest clients, but not all.
Their premiums did go down, but in some cases, their federal tax credit went down even more.
So part of this session is dedicated to finding fixes.
We're working on finding funding sources to backfill them to make sure no one was harmed by that.
Another part is figuring out how to keep the programs past last session moving forward.
We need continued funding for the reinsurance program.
And then there could be some more radical changes in store, like a public option to offer health insurance through the state. But with all the things lawmakers are planning on adding, like covering fertility treatment, we wanted to know.
How do you balance this dichotomy of adding more services, but also saving people money and cutting on costs?
Yeah, it's very important to get the big things done to reduce costs. So you can do a few small things with the savings, like expand coverage and access with some of the savings.
Republican Representative Patrick Neville doesn't buy that, though.
The more we continue to add, we're going to only increase costs.
And he doesn't believe the public option will help either.
All those costs that it might save one consumer some money, but that's passed on to all the other consumers. And then overall, this is why we see those contributing factors to increasing cost of health care.
Competing views on a complex topic, all in the pursuit of cutting health care costs.
And let's save people money on health care.
So this time around, the governor's roadmap includes 5 things: adopting a public option, expanding insurance purchase alliances, increasing drug price transparency, supporting primary care, and implementing behavioral health reforms. Now, we've already done a story about the drug price transparency bill. That's on our website. And in the coming weeks, we're going to be following up on each one of these topics as we kind of tackle this topic of looking at people's health care costs.
And it's a huge topic.
It affects us all.
My gosh,
all
yes.
right, Megan, thank you very much.
Thank you, Megan.